Hello friends. Today we are going to discuss about organic brain syndrome, also called brain injury. Why should we know about this? What is the importance? What is the role of any citizen or a counselor? We'll discuss in this video. I'm Dr. Suresh Padadmat, Professor of Psychiatry working at Nimans, Bangalore. Why should we know? See, brain injury is a severe, life-threatening and requires immediate attention, such as head injury, maybe stroke, maybe paralysis, infection, epilepsy, tumor, drugs or alcohol withdrawal. Such scenario, you should be able to identify it and refer immediately. There is no point in wasting time here because you may think that this is a simple condition, but invariably it will be life threatening. So, every counselor and also every citizen should know about this brain injury or else organic brain syndrome. This is the time which is a golden hour, we call it as. The person needs immediate medical attention. He needs to be admitted to intensive care unit, requires various medications such as antibiotics, steroids, various anti-edema measures. So for that reason, you should not engage the patient for longer duration. The only thing we have to do is talk to the family, make sure they take help from the nearest doctor. Let's now discuss various brain injuries or various organic brain syndromes. First and the foremost, let's understand how do we identify this organic brain syndrome. The simplest is loss of consciousness. If a person is unconscious, that means he has a severe brain injury or else organic brain syndrome. On the other one is altered consciousness. The person is confused. He is unable to tell the time. He is unable to name the person in and around. He is unable to identify his family members. He is unable to identify which place he is in. So, how to ask such question? Whenever a person is having these kinds of symptoms, you have to ask simple questions. What is the time now? What is today's date? Where are you? Which is this place? Who is this person standing next to you? So, such questions you can ask. If the person is unable to answer, that means he has sustained severe brain injury. The next important is third one is seizures. If a person has fits or else seizure, that means the injury is at the brain level. The next important commonest, that is the fourth one, is bowel bladder incontinence. That means passing urine in the clothes and also passing fecus in the clothes. That means invariably the human being by the age of 7 to 8 or 10, the all human beings they become dry, they do not pass urine or fecus in their clothes. But whenever there is a brain injury, invariably they start passing urine in the clothes, they pass fecus inside the clothes. That means they require immediate attention. The next fifth important point is focal neurological deficit. That means weakness of the limb, slurring of the speech, unable to lift his hand or leg, unable to walk, sudden fall. These are the symptoms you should be very careful. So please remember five important symptoms to understand that the person has sustained brain injury or else organic brain syndrome. First is loss of consciousness, altered consciousness, seizures, bowel bladder incontinence, and focal neurological deficits. Let's now move to the commonest form of brain injury, that is head injury. See, head injury. So, head injury means head is having various coverings. First and the foremost is skull, that we call it as cranium. After that, we are going to have various coverings which we had discussed in the previous class. From the inside out, first and the foremost is brain. After that is pia mater, arachnoid matter, dura mater, and cranium. After the cranium is nothing but a skull. After skull, there is muscles and then skin. So any injury to the head can cause various level of trauma or injury. It may be injury at the scalp is skin, at the muzzle, or it may be at the level of skull and then the dura mater or it may be at the arachnoid matter, or at the level of the brain. Depending upon the various site, the symptoms will be seen. For example, if there is a significant brain injury, that means head injury. If a person sustained a head injury, he gets up and walks away without any problem. That means unlikely he has sustained brain injury. Please do understand there is a difference between head injury and brain injury. Head injury means any injury to the head. Brain injury means because of the head injury, it has resulted in the brain injury. That means head injury was so severe inside the brain has resulted in some kind of trauma. Let's now understand in what are the circumstances and how signs and symptoms we can identify head injury. The first and the foremost common symptom is as soon as the head injury occurs, if the person loses consciousness or he is in coma, that means he has sustained severe brain injury or organic brain syndrome, loss of memory, he is unable to remember what happened recently. That means he has sustained head injury. And he is in altered sensorium, that is, he is completely confused. He does not know where he is standing, who is next to him, who is this, which is this place, what is the time, if he is confused. Again, it is a severe head injury. Severe penetrating injury. That means you can notice there is a skull has been broken, the brain matter is coming out of the skull. Then S, it's a severe head injury. ENT bleed. If there is a bleeding from the nose, ear, or from the throat, that also requires immediate attention. Seizures. If a person immediately after the head injury throws a fit or a seizure or epilepsy, that requires immediate attention. If a person immediately after head injury starts vomiting, I will let you know why the vomiting occurs shortly. And the next one is CSF leak, that is cerebrospinal fluid leak. I had discussed you with the previous video, there is cerebrospinal fluid which covers the brain. If there is a head injury and there is a break in the skull, that liquid start coming out of the skull. That clear liquid also indicates there is a severe head injury. So if you look at this skull and also there is a brain inside, if there is a sudden injury or head injury, sudden trauma or a blow on the skull, this results into bleeding. Here the bleeding starts. If the bleeding starts because it's a, please do remember, the brain is inside a closed compartment. Inside the compartment, if the bleeding starts, the blood pouring increases. As the blood increases, it increases the pressure inside the brain because already brain is inside a closed compartment. Inside the compartment, the blood is pumped in. If the blood is pumped in, the brain has to move in one or the other direction because the blood is gushing inside the skull. As soon it happens, there will be brain herniation. Once the brain herniation occurs, the prognosis becomes poor. The prognosis is poor means the person is high chances of he is going to die. So during that period, whenever there is a raised intracranial pressure and the herniation starts, that means there is a high indication he needs to be immediately admitted to the ICU. During that time, whenever the raised intracranial tension starts increasing, that means pressure inside the skull increases, the vomiting starts. As you remember in the previous video, we talked about brainstem. The brainstem has three important functioning. One is heartbeat, respiration, vomiting center. Since this vomiting center is being stimulated, the person starts vomiting very severely. The vomiting, and even if the herniation increases, the respiration starts stopping, heartbeats stops, then the person dies. Hence, once the brain herniation occurs, it is very difficult to rescue unless there is an immediate ICU care, and also he may require immediate surgical intervention. So please do remember, whenever there is an head injury, if there is a loss of consciousness, altered consciousness or altered sensorium, confusion, memory loss, epilepsy, bowel and bladder incontinence, seizure, please refer them to the doctor at the earliest. Do not waste time. Coming to infection, the next commonest, because everybody gets infected. The infection can be because of bacteria, virus, maybe fungus, maybe various other parasites. So let's discuss which are commonest. The two most commonest is virus and bacteria. See, if you look at the virus and bacteria, they are very, very small, smaller than our cells. If you look at this, look at the diagram. The diagram clearly talks about, if you look at the ant, that is 1 millimeter, the thickness of the hair is 100 micromillimeter, and our cell is 10 micromillimeter. That means it's very small. It has to be seen. Now, once it becomes 10 micromillimeter, it has to be seen under the microscope. And if you look at the bacteria, bacteria is 1 micrometer. And then virus, 100 nanometer. And then the protein, which is very small, maybe around 10 nanometer. And molecule is 1 nanometer. So the difference between virus and bacteria, the virus is 100 nanometer, bacteria is 1000 nanometer. That means bacteria is 10 times bigger than the virus. Virus is very small. So both the virus and bacteria gains entry into the body from various area. The simple is COVID infection. The COVID infection enters through the pharynx or nasopharynx, lungs. From there it enters into the blood and then it will reach brain. Many people do get fever, but however, they do not get brain infection. So let's discuss about this brain infection. So let's focus on two things, viral and brain infection. Any kind of brain infection is called as encephalitis or else meningitis. If it is because of virus, we call it as encephalitis. If it is because of bacteria, we call it as meningitis, or else it's basically infection of the brain either because of virus or bacteria. We can call it as, invariably the doctor will report to you telling that the person has brain fever or fever has reached the brain. What are the signs and symptoms of fever reaching the brain or else brain infection or else encephalitis? There should be high fever, severe headache, along with loss of consciousness. The person is completely has become comatose or else he has become confused. He is unable to name the person, name the family members, and he is unable to name the place, and also he is unable to tell the time, date. That means he is confused. If the person has seizures, neck rigidity, this is one of the pathognomonic sign. That means if the person is unable to flex his head forward and a rigid neck indicates a severe brain infection, along with bowel bladder incontinence. That means he is passing urine and also fecus inside the clothes. So that means these are the important signs of telling that the brain has been infected with either the virus, bacteria, fungus, or any other parasite. So in such a scenario, the person requires immediate care, immediate medical care. He needs to be admitted in ICU. He requires various antibiotics, maybe even antiviral medication, especially we have seen in coronavirus infection. He needs to be admitted to the ICU. Life saving measures like artificial ventilation, he may require oxygen, and he requires close monitoring for various parameters. So, whenever there is a brain infection, please do not waste time. He needs to be admitted in the ICU and a proper care has to be given. The more the delay occurs, the person may die or there may be a brain infection sequelae. Sequelae in the form of memory loss, paralysis, weakness. So, the brain infection needs to be treated at the earliest. We have seen in the winter season or in the various other seasons, we see children developing encephalitis and many of them may die. So, as soon as there is a fever and the child becomes confused or loses consciousness, please do take them to the doctor immediately. Do not waste time. If you look at the central nervous system, that is the brain and the spinal cord, you can look at the brain and spinal cord, and it is covered from the skull and the spinal vertebrae. And if, as if you have been already been discussed about the brain and the spinal cord being covered by a cerebrospinal fluid, invariably to know whether what kind of bacteria or what kind of virus has infected the brain, usually doctor will remove water 2 to 3 ml from the spine, that is from the back, and they will insert the needle and they withdraw CSF, that is cerebrospinal fluid, and they test this fluid whether there is a virus or bacteria, and also to know for what antibiotic these bacteria responds. Depending upon that, they will give antibiotics. So this is L3 and L4 is the spine where the needle is inserted and the cerebrospinal fluid is taken for investigation. Now, after discussing about the infection, we move towards the stroke and hemorrhage, that is paralysis. See, if there is a blood supply to the brain, if the artery break opens, that is called as hemorrhage. If there is a blockage, that is called as stroke. So please understand difference between hemorrhage and the stroke. Hemorrhage is burst opening of the artery, stroke is blockage. Usually the stroke occurs at the age of 50 to 70 years. The reason being is, imagine your body as a house or a building. The water supply inside the building is equivalent to artery. As the age of the building becomes 60 to 70-year-old, the water supply to the house, that the whole water pipe becomes clogged. And over a period of time, the water supply, we have to give the water supply means you have to force the water through that small lumen of the pipe. If the pipe burst opens, that is called as hemorrhage. If there is a blockage completely, that is called as a stroke. So as the age progresses, if you have a poor lifestyle and if you are eating a lot of fatty cholesterol food, that means that leads to the thinning, or what we call it as the lumen start decreasing of the artery. As the artery becomes small or the lumen becomes small, then the blood pressure increases. Then as the blood pressure increases, the artery burst opens. At the same time, many a time, even there is a blockage in the artery causes stroke. This is a classical uh, picture where you can see the carotid artery, there is a blockage. Because of the blockage, certain part of the brain has been completely blocked, and that causes complete stroke. The stroke is nothing but paralysis or else weakness of the limbs. So, what are the signs and symptoms of paralysis? First and the foremost is loss of consciousness. If there is a sudden hemorrhage or a stroke, the person may lose consciousness, or else there will be confusion, altered consciousness, slurring of speech. The person starts what we call it as the speech becomes very difficult to understand, and the person will not be able to speak properly. We call it a slurring of speech. Sudden onset of weakness. He is unable to lift his limb or hand, or he may sudden fall may be there, and also headache and vomiting. Sudden onset of severe headache at the age of 50 to 60 with associated blood pressure is there, we should suspect stroke. At the same time, gallbladder incontinence also indicates there may be a severe brain pathology to indicate towards the stroke or hemorrhage or paralysis. Now, after the stroke, we will move towards the brain tumor. Tumor is basically the small to big, depending upon the nature. There will be a tumor, or what we call it as it may be benign tumor or else a cancerous tumor. So that kind of there is there. You can see in the CT scan there is a white structure where there is a tumor. Depending upon where the tumor is there, the symptoms will be presenting in the brain, and that requires immediate attention. Otherwise, it is life threatening. Moving towards the seizures. Seizures are nothing but fits, or also called as epilepsy. You We have discussed brain has 8,000 to 9,000 crore neurons. These neurons, as we had discussed in the previous video, the electrical impulse starts from the body, that is from the uh, dendrites or from the nucleus, and it moves towards the axon and then goes to the synapses and transfers it into the next neuron. So, similarly, if you look at this, the electrical impulse started and it moves towards the synapses. Near the synapses, electrical impulses are converted into neurochemical, or what we call it as a chemical. This chemical moves towards the next neuron and produces again electrical impulses. Electrical impulses converted into chemical, that is neurochemical, from there to again electrical impulses. These electrical impulses becomes episode, then the seizure occurs. That means seizures are nothing but disorganized, in not synchronized form of electrical impulses in the brain causes sudden loss of consciousness, and the person falls down and throws what we call it as epilepsy. So there will be tonic clonic muscle contraction with passing of urine, tongue bite, sometimes head injury or bodily injury. During epilepsy, if the person is driving the vehicle, he may meet with an accident. If a young lady is cooking food, she may sustain severe injury or burns injury on her body. Epilepsy requires medication. There is no point in any kind of doing what we call it as counseling. Epilepsy, seizure, please give medicine. Don't stop medicine without the doctor's advice. The next important organic brain syndrome is alcohol and drugs related issues. If there is a sudden increase intake of alcohol or maybe drugs in the form of opioid, maybe cannabis, cocaine, any other drugs. If there is an intoxication, then also the person is in high danger. He requires immediate medical attention. Withdrawal, that is, sudden stop of alcohol or sudden stop of any drugs, can cause severe withdrawal. That person becomes highly excited or else he becomes highly violent. That time again he requires medical attention. Because of alcohol and drugs, there may be some medical or surgical complication. Imagine if somebody has taken alcohol in the night and while he was going back to home, he fell down and sustained head injury. He doesn't remember because of the high dose of or high quantity of alcohol intake, he does not get pain immediately, or else he would have sustained injury, but he doesn't tell anybody because he is in a altered consciousness. And next day morning, he may die. So, whenever there is any complications in the form of head injury after alcohol or drug intake, may require CT scan or any kind of medical intervention. Legal complication after alcohol or drug intake, that person may get into violence and may get into legal complications. So, dear friends, please do remember organic brain syndrome. There is no point in engaging and counseling the patient. The patient requires immediate medical attention. Organic brain syndrome in the form of head injury, infection, epilepsy, alcohol substance withdrawal, hemorrhage, stroke, or paralysis. That is the scenario. Don't waste time in engaging the patient in counseling. They need to be immediately referred to the doctor to make sure that they get timely medical intervention and we can save their life. So, please do not engage them for longer duration. Refer them to the nearest doctor. Organic brain syndrome requires immediate attention. To know that they have organic brain syndrome, simple tests like asking for time, date, name the place, person, ball bladder incontinence, epilepsy, unconsciousness, neck rigidity, high fever, and recent fall or weakness or focal neurological deficits. If these are the things are there, please do refer them to the nearest doctor. If you like this video, please do refer, please do subscribe to my channel. Thank you. Stay safe.